Greetings. I want to talk about preeclampsia, which means hypertension in pregnancy, and I want to go straight to the point because it's a very long video. Now, in preeclampsia, I'm going to look at the meaning, the symptoms in pregnancy, the diagnosis, the causes, and the treatment and the complications that can arise from it. You see, preeclampsia is a very dangerous condition in pregnancy. And if not well taken care of, it can cause serious harm to the woman and to the baby, and even to the family of the woman. What I mean, the family of the woman is the husband and the relatives. Now, preeclampsia simply means elevated blood pressure in pregnancy after 20 weeks of pregnancy. That is, preeclampsia can only be diagnosed after 20 weeks of pregnancy. So if a woman have elevated blood pressure of greater than, let's say, 150 over 100, 160 over 100, or anything greater than 140 over 90, and with symptoms of protein, with features of protein or presence of protein in the urine, like 3 plus of protein, 2 plus of protein in the urine, that is preeclampsia. Now, elevated blood pressure, then you do a urinalysis, you do urine test, and when you do urine test, you will see the presence of protein of maybe 1, 2, or even 3 in the urine. That's preeclampsia. Now, what are the symptoms of preeclampsia? What are the symptoms of preeclampsia? One, okay, I've mentioned that the woman has elevated blood pressure. There may be headaches. The woman is not able to sleep well. The body is swelling up. The woman is not blood vision. The woman is not seeing well. You know what I mean? The woman is not seeing well. Another thing is the woman is not. It can even cause straight blindness, abdominal pain, especially on the right side or upper side of the abdomen. The woman has abdominal pain on the right upper side of the abdomen. Then another thing that may arise, another symptom is this. Okay, so some we present with okay, I've mentioned headaches, I've mentioned straight seizures. The woman will just have straight seizures, which means convulsion. The woman will be fine. All of a sudden, the woman will develop convulsion. And when that happens, when preeclampsia leads to convulsion, it's no longer preeclampsia, it becomes eclampsia. Now, in the diagnosis of preeclampsia, you use these symptoms plus the laboratory investigation to make that diagnosis. The symptoms I've mentioned, like the blood vision, the headaches, blindness, abdominal pain, vomiting, nausea, you are feeling nauseous, and elevated blood pressure now. Plus, when you do urinalysis, you'll find out that there is at least 3 pluses of protein in the urine. Then that's preeclampsia. That's straight preeclampsia, and you need to be treated. Now, what causes preeclampsia? You see, during the course of pregnancy, during the course of conception, the placenta is what feeds the baby, and the placenta attaches to the wall of the womb, right? And when the placenta is formed, some new blood vessels are formed that will help give nutrients to the baby, help remove waste from the baby and the rest. Now, normally, the blood vessels that are formed work perfectly in the woman, and everything will be fine. But in preeclampsia, the new blood vessels that are formed in the placenta to help carry out this function are defective. It's either they are not formed at all, or when they are formed, they are not carrying out their proper function. They are poorly developed, or if they are formed at all, they are not well developed. So it causes preeclampsia. That has the primary cause of preeclampsia. So it's the primary cause of preeclampsia is a placenta problem. Now, there are other causes of preeclampsia for women that are obese, and they are at risk of preeclampsia. Women that are obese. If you have a family history of preeclampsia in your mother, your mother had a family history, or your mother had preeclampsia, or your grandmother or your aunt, the likelihood of you having preeclampsia is also high. If you smoke, Yes, it can also increase your risk of preeclampsia. If you have a new partner, yes, you normally have you know what I mean by new partner, though. You had a husband, a partner before that you have children for, but all of it, I don't know, whatever have happened, you left that person and you have a new relationship. You have a new relationship, and that new relationship can the it is it there's a theory that the sperm of that man can your body may not be able to react to it well during that conception, and it can cause preeclampsia, eh? Obesity, and if you are black, preeclampsia will be found more in black people than in whites. Eh? Preeclampsia will be found more in black people than in white. So that's also a risk factor for preeclampsia. If you have diabetes in pregnancy, you're also at risk of preeclampsia. If you have kidney disease before you got pregnant, you're also at risk of preeclampsia. If you have hypertension before you got pregnant, there are some people you like you are hypertensive already before you took in. You're also at risk of preeclampsia. So you may develop preeclampsia during the course of the pregnancy. And most times, women that develop preeclampsia also, it's not their first pregnancy. It's women that have had, most times it's from the second, third, and fourth pregnancy. It's not that it cannot happen in the first though, but it's commoner in the second, third, and fourth pregnancy. So the more children you have, the more deliveries you are pregnant, the more the higher the number of times you get pregnant, the higher the chances of you developing preeclampsia. Is that clear? So I've mentioned so many things that can cause preeclampsia. Now, if there's any other cause of possible preeclampsia, I will let you know. So, but just know that the primary cause of preeclampsia is placenta problem. Placenta problem is the primary cause. And if you have a new partner, if you smoke, you take alcohol in pregnancy, those things can cause, you have diabetes, it can also cause preeclampsia. You're already hypertensive before you took in, it can cause preeclampsia. Now, what are the complications that can arise from preeclampsia? It can lead to the death of the baby. It can lead to the death of the mother. It can cause premature birth. You deliver before time. It can cause intrauterine growth recession. That is, you have a child with low birth weight. You have a child with low birth weight. Then it can cause seizures, convulsion. Eh? Convulsion, it can cause blindness. If not, that is, if the complications and the bad things that can happen from preeclampsia, it can cause blindness. Then another thing is that it can cause stillborn. It can make a woman have stillborn. So those are the complications of preeclampsia. It can make a woman, the lungs will not be properly developed. It can also cause difficulty in breathing in women. Difficulty, it can cause kidney failure, it can cause liver failure. There's a condition called HELP syndrome where there is elevated liver enzymes and low platelets. So the woman is prone to bleeding. Now, those are the complications that can arise from preeclampsia: stillborn, premature birth, birth defect, oligohydramnios can arise because of preeclampsia. That is why you see preeclampsia is a very deadly disease. Does preeclampsia have treatment? Yes, it has treatment. It has treatment. When you have preeclampsia, you will be placed on drugs. And during pregnancy, you'll be placed on drugs. And make sure you are taking the drugs. Most of the drugs used are labetalol tablets or what's it called now? Adomet, metidopa. You'll be placed on this drug. Make sure you are taking them. Then you'll be also be given aspirin, low dose aspirin that you'll be taking every day. Then a drug will be given to you to help prevent seizure. It is called magnesium sulfate. So you'll be taking it to help prevent seizure. But the treatment of preeclampsia depends on the severity though. If the preeclampsia is very severe, your doctor will tell you that you need to deliver the baby, because the definitive treatment of preeclampsia, the only time that hypertension will leave you is when you deliver the baby. So that is that. So you will end up being induced to deliver the baby, or a CS will be done for you for the baby to come out. But as soon as the baby comes out, you'll notice that your blood pressure comes down. So those are the things with preeclampsia. The video is going to be a long one. Now, can preeclampsia be prevented? Yes. There is a protocol where women that have a history of preeclampsia or have family history of preeclampsia, or who stand a high risk of developing preeclampsia, are given aspirin when they are pregnant. And this helps to prevent preeclampsia. Bye-bye.